This is going to be the fastest and easiest video you have ever heard about SOAP notes. Hi, I'm Dr. Maelisa McCaffrey, founder of the free Private Practice Paperwork Crash Course, and I recommend that for SOAP notes, you add these things into each section. In S, in the subjective, you can include any topics that were discussed and literally just put topics discussed, colon, and then include some phrases. 2 to 3 is fine. Then you can also include any client quotes. In the O section, objective, include the client presentation, which would be a mini mental status of mood, affect, behavior, and any symptoms that are presenting. You can also include your interventions there. So literally just add those subheadings into that section and don't think about it further. For assessment, that's where I recommend you include your client progress statement, which has a statement about how the client has progressed toward their goals and their continued impairments or challenges. This is what you need for insurance specifically, but it's also just really helpful to track in general. And then in the P section for plan, you're going to include what it is that you'll do before the next session, what your client will do before the next session, so any homework or actions they're going to take, reflections they're going to have, and when will you see them next. And that's it. So make it as quick and easy as you can.